Thank you. So I am a nurse, and I was lucky enough to be working as a nurse while the Affordable Care Act was being implemented. And I was very lucky, very happy to see people my age that were coming in that were finally getting treatment for chronic conditions like Crohn's disease, like severe asthma. They were getting tested for reproductive cancers, which people my age are most at risk for. The time in between that graduating from college or being out of your parents' house and before you can get that nice paying job that's supposed to be out there, sort of when you're the most vulnerable, we finally got to see people get treated for this, and it was just wonderful. The fact that these kids were not treated and then could say, I have the ACA now, I can go back on my mom's insurance, this is wonderful. They were able to continue on with their lives and not just survive, but actually sort of participate in the American dream, actually get to go out and sort of chase their dreams because they weren't worried about how am I going to stay trapped in this job because it's the only one that will pay for my medication because I have a pre-existing condition. I myself had lost my insurance at 19. By the time I was 20, I had, I think, about $30,000 of medical debt. I wasn't able to go back to college. I wasn't able to do so much until later in life because I was so trapped by my medical debt. I know there are so many people, again, as a nurse, I see people that still can't afford things, that still can't access certain kinds of care because of cost. And the idea of losing ACA absolutely terrifies me on a personal level and on the level of the patients that I see. I work with low-income families. I work with foster children. I work with people that don't have a lot. And the ACA gave them something. The ACA made sure that they could get their insulin. It made sure they could get their asthma inhalers. And it may seem like it's this terrible thing because it's called Obamacare, referred to as Obamacare, and because it affects maybe people that sometimes those in Washington don't really care about. But it's something that I don't want to see go away. It's something I want to see improved. I just been very lucky to have won a scholarship that let me spend the last few months in Europe and seeing how their healthcare system worked, seeing how they used their resources to take care of the most vulnerable, seeing as to them it was a matter of pride and a matter of character to take care of the most vulnerable people in the community. That's something that I would like to see here. And to you, Congressman Soto, I hope that you continue to fight for the people that are the most vulnerable, for the people that don't make multi-million-dollar political contributions, but still matter, still mean something, and they make up the country, they make up who we are, and they are so important, and they deserve to be protected.
Thank you, Faith.